How does Social Security evaluate a mental health condition when you first apply for SSDI? One of the most important things to understand is that a diagnosis by itself usually isn't enough. You might have been diagnosed with major depression, anxiety, PTSD, bipolar disorder, schizophrenia, OCD, or another serious mental health condition. But SSA is ultimately trying to determine how that condition affects your ability to function and whether you can sustain work. At the application stage, SSA will review the medical and other evidence in your claim. That can include records from psychiatrists, psychologists, therapists, hospitals, clinics, and other healthcare providers. They may look at your diagnosis, symptoms, medications and side effects, treatment history, psychological testing, hospitalizations, and how you've responded to treatment. SSA may also consider what you report about your symptoms and daily activities, along with other evidence in the record. The goal is to understand not only what condition you have, but what that condition prevents you from doing. For mental health conditions, SSA pays particular attention to areas of functioning that can be critical in the workplace. For example, how well can you understand, remember, and follow instructions? Can you stay focused long enough to complete tasks? Can you maintain an appropriate pace throughout a normal workday? How do you interact with supervisors, coworkers, or customers? Can you handle ordinary workplace stress, criticism, deadlines, or changes in routine? Someone may appear capable of performing certain activities occasionally, but still have significant difficulty doing them consistently enough to maintain full-time employment. SSA's Residual Functional Capacity Assessment considers the ability to perform sustained work activities on a regular and continuing basis. SSA also has specific disability listings for mental disorders. If your condition satisfies the medical and functional requirements of an applicable listing, you may be found disabled at that stage of the evaluation. But not needing the listing does not automatically mean your claim is denied. SSA can continue evaluating the claim and determine what work-related mental abilities you retain despite your limitations. This is why the details in an application matter. Saying, "I have severe anxiety," provides much less information than explaining that anxiety causes panic attacks several times a week, prevents you from leaving home on certain days, or makes it extremely difficult to interact with other people. Similarly, saying, "I have depression," is different from documenting problems with concentration, motivation, completing tasks, maintaining a schedule, or consistently getting through a normal workday. Mental health symptoms can also fluctuate. Having better days doesn't necessarily tell SSA whether you're capable of sustaining competitive employment over time. The overall evidence and the consistency of the limitations described throughout the claim are important. At Disability Advocates Group, we help SSDI applicants through every step of the application and appeals process. If your mental health condition is keeping you from working, call Disability Advocates Group at 800-788-2095 for a free consultation, or visit ssdianswers.com and complete our free SSDI screener to see if you may qualify for Social Security disability benefits. This video provides general information about SSDI. It does not constitute legal advice.